Dozens of cancer survivors and advocates from West New York are headed to Albany to push for change. They're hoping to make their voices heard at the state capitol on key legislation affecting the cancer community. News Source Gwen Napier has this story. Gwen?
It was an early start to a busy day for a group of cancer survivors and advocates from Buffalo who headed to Albany for Cancer Action Day, where they joined others from across the state in a push for change at the Capitol.
What we've seen in Western New York especially is when people from Western New York are telling their stories, we're able to see a lot of movement in the bills in the last couple of years. We've had a lot of major wins by people just sharing their stories and why this is important to them. I think it's easy to get pessimistic, but your stories really do matter. So it's important for us to give them this platform and have them come and tell their stories.
The group, working with the American Cancer Society Cancer Action Network, is calling on lawmakers to support 3 key proposals. One would improve access to lung cancer screenings. Another would update New York's paid family and medical leave program for the first time in more than 30 years. And the third would expand patient navigation services statewide.
Lung cancer is one of the biggest killers in both men and women, and unfortunately only about 19% of people who are high risk are getting screened, and some of that is refers to cost. So if somebody goes and gets a test and something pops up and they say they need further testing, insurances right now can say, oh, we've covered your test for the year. And that creates an issue where people then don't get further diagnostics. So we're trying to make it more fair, more affordable for everybody.
I think that they need to hear from the people who are affected most. And I have 30 years being cancer-free, and I thank God for that, but we still need to make it accessible for anybody who wants any kind of testing to be done. It shouldn't be a barrier there.
For them, it's more than just a trip. It's taking personal battles and changing them into powerful changes. They're standing up for those families and patients who need a stronger system. In Amherst, Gwen Napier, News 4.